Welcome to Fibnacura, where care becomes healing. Have you been struggling with stubborn acne, irregular periods, or unexpected facial hair? This could be early signs of a condition known as Polycystic Ovary Syndrome, commonly called PCOS. What is PCOS? Let me break this down in simple terms. PCOS is a hormonal condition that affects women of reproductive age, that is, women of childbearing age. It happens when the body produces higher level of male hormone called androgens. Although every woman naturally has a small amount of these hormones, but in PCOS, the level becomes higher than normal, which can interfere with ovulation, which is the process where the ovaries release an egg every month. Because ovulation becomes irregular due to the higher level of androgens in the body, the ovaries may develop small fluid-filled sacs called ovarian cysts. This hormonal imbalance can affect the menstrual cycle, skin, hair, and even the metabolism of the individual. How does PCOS affect hormones? In women with PCOS, the body hormones become unbalanced. Their hormones is not balanced. For example, the body may have trouble responding properly to hormones like insulin, and this condition is known as insulin resistance. When insulin levels become high, it triggers the body to produce more male hormones, making the PCOS symptoms worse. So PCOS is not just about the ovaries. It is actually a whole body hormonal condition. How does PCOS affect the skin? One of the earliest places PCOS shows up is the skin. Hormonal imbalance can overstimulate oil glands, which may result in persistent acne, especially around the jawlines and chin. Excess facial or body hair, oily skin, dark patches of skin. Many women treat the acne or hair growth without realizing that the root cause may be hormonal. Now let us talk about the early warning signs of PCOS many women ignore. Many women live with PCOS for years without realizing what is going on. Some early signs include irregular periods, not seeing your period for months, or the period comes late, or it comes early. Sometimes the period stops completely. The second sign is stubborn hormonal acne. Acne that does not respond to normal skincare treatment. The third one is unusual hair growth. Hair appearing in the chin, upper lip, chest, or abdomen. Thinning hair on the scalp. Darkening of the skin, especially around the neck, under the breasts, or armpit. Difficulty losing weight, even with diet and exercise. Always feeling weak and tired, or craving sugar. Trouble getting pregnant because irregular ovulation can affect fertility. Now let us talk about why early diagnosis matters. PCOS is a manageable condition, but ignoring it for years can increase the risk of other health problems such as type 2 diabetes, high blood pressure, fertility challenges, endometrial cancer in some cases due to prolonged irregular period. This is why early diagnosis and proper medical guidance are important. So how is PCOS managed? Although there is no single cure for PCOS, the condition can be effectively managed. Treatment often includes lifestyle adjustment like balanced nutrition and regular exercise, hormonal medications to regulate menstrual cycles, medications that improve insulin sensitivity, dermatological treatment for skin symptoms. Most importantly, management is individualized because every woman's experience with PCOS is different. So if you notice changes in your menstrual cycle, your hair growth, your body may be asking for attention. PCOS is common, but many women suffer silently because they don't know what is happening to their body. The earlier you recognize the signs, the easier it is to manage. Your hormones speak through your body. The question is, are you listening? Thank you for spending the moment with Fibina. Remember, your health is a journey, not a rush. Take care of your body. It is the only place you live. See you next week.